Hello everyone, welcome to Chapter 7 on the skeletal system. This will be Part 1A on the axial skeleton, and let's get started. Now, the PowerPoint for Chapter 7 is set up a little bit different. Usually we'll use it to kind of get ready for our exam and study all the text and pictures, but this PowerPoint will be for illustrative purposes only. And the reason for that is there are no images on your upcoming exam. Instead, what you will need to do is you need to download the Chapter 7, the Skeletal System Study Guide Word document, and this will then be your item that you'll be studying off for your questions. The exam 2 questions will be descriptive based, and they will also ask you to identify the specific structures that are related to the bones. In order to make sure that you know everything you need to know, you need to get your Chapter 7, the Skeletal System Study Guide. This study guide is located in your exam number 2 module on Canvas. I'll be narrating through the slide using the study guide as my guide. That way it makes it easier for you to follow along as we will look through the skeletal system. And I also want to encourage you to please post all your questions, comments, and concerns in the designated discussion sections on Canvas. So having said that, let's start taking a look at the skeleton system. Now, how we're going to handle this is we're going to take a look at how we divide our bones within the body. We've spoken about the skeletal system before, we've discussed it in our histology chapter, and we've taken a look at the different cartilages and bones and joints that it entails. So now we get to the part where we actually have to name all the different bones related. In order to do that and keep track of everything, we're going to take a look at the 2 major divisions, which will be the axial skeleton and the appendicular skeleton. The axial skeleton will consist of your skull, your vertebrate column, and your thoracic cage. And as you can see both on the PowerPoint as well as on your study guide, it has indicated for you not only the 3 main regions, but also the functions of the axial skeleton, which include providing the longitudinal axis of the body, support for your head, neck, and trunk region, and obviously protection for more sensitive organs such as the brain, the spinal cord, and the lungs and heart found in the thoracic cavities. Here on this illustration, highlighted in blue, are the sections that are dedicated to the axial skeleton. Highlighted in blue text to make it easier to identify, you can see the skull, the thoracic cage, and the vertebra. Here is the posterior view. Notice how the same color code is used. Everything in blue-green is related to the axial skeleton, and then everything in the lighter shade of khaki is for the appendicular skeleton. The appendicular skeleton will concentrate on what we call your appendages, which will be your extensions, aka your arms and your legs. All right, so looking at my study guide, I see that the axial skeleton will start off by taking a look at the skull. And the way we're going to become familiar with the bones of the skull is that we're going to concentrate on the ones that are important for your cranial bones, forming the cranium, which is what surrounds the brain, and those that are involved with the facial bones. So on your list, you will go ahead and see the bones that you will need to know. And you're also going to see that some have what we call notable structures. These are items that you will need to identify at a later time belonging to the specific bone that you are looking at. We will also discuss sutures, which are the joints, immovable joints that bones will use to seal the facial bones as well as the cranial bones together in the skull. Here is a look at the cranium bones on top and the facial bones at the bottom. As you can see within the skull, the cranium bones will cover the cranium, which is where the brain is housed, and the facial bones is located more towards the anterior of the face. Now on this look, what we're looking at is what we call the cranium fossas. Fossas are going to be little dips. And what we see happening is as the brain sits in the cranium, it is divided into the anterior, middle, and posterior cranial fossas, which are little dips that will fit the brain sections perfectly. And in fact, we can click over to our following slide, where we will see an illustration of the brain actually sitting inside of the cranium. And you can see the dips from the anterior, middle, and the posterior. Alrighty, so now let's get to actually naming some of these bones. Now, within the cranial bones, it turns out that we have 8 bones that will work together to form the cranium. And within the 8 bones, we have 2 of them that are paired, and the other can only be found in the single format. So referencing my study guide sheet at the bottom of the first page, I see that it says I have 8 bones in contact with the meninges. They will be the frontal bone, the parietal bone, the temporal bone, the ethmoid bone, the sphenoid bone, and the occipital bone. So those are the bones that we will be exploring along the way. So let's go ahead and take a look at some of these bones before we identify them individually. So here's an anterior view of your skull. And one thing that you're going to notice is that all the pictures are color-coded, and the color of the bone will stay consistent regardless of which view you're looking at. So for instance, right over here, I've highlighted the frontal bone in the front, which has a nice little yellow shade to it. The parietal bone on the side has more of an orange view to it. And then the temporal bone is located on the side, which is leaning towards more of a dark orange shade. So let's go ahead and take a look at it from a different angle. And you can see same exact color code. And like I said, this is just a little preview of the bones to come individually. I've highlighted the bones in blue to make them easier to find. So you can see that the same exact colors are being used for the frontal, the parietal, and the temporal. And from this angle, we can also get introduced to the sphenoid bone in pink, and then the ethmoid bone that's kind of tucked away within the occipital cavity. You can see it in a brown shade. Here is it from a mid-sagittal cut. Sometimes it makes it easier to identify small, irregular shaped bones if we were to take a cut out of the skull so we can see how they are fused together. A good example of a bone like that would be, for instance, our little ethmoid bone, which we previously just saw as a small little brown spat. In this midsectional, you can really see the perpendicular plate as it extends within the nasal cavity. Here is a look with the skull cap removed, and this is going to be very helpful when we start exploring our ethmoid bone as well as our sphenoid bone, which is that beautiful pink bone that kind of looks like a bat if you're looking at the overall shape. All right, and here is a posterior view that's going to allow us to take a look at what's happening on the back of the skull. And obviously the highlight here will be for our occipital bone. And also you can see your parietal bones coming from the top to the side of the skull. Here is an inferior view with the mandible, the lower jaw removed. And once again, you can see your temporal bone, your sphenoid bone, your occipital bone, your parietal bone. Keep an eye on the fact that the colors are consistent, making it easier to identify when you go from side to side. Now, some of you might be wondering, well, if there's no pictures on our exam, why are we even bothering looking at these? Well, because one, you want to be able to see where the bone is actually oriented, and it's very useful for someone who's visually inclined. But also the second reason is because you will have a homework assignment where you'll have to label the various bones. So these PowerPoints will give you a nice amount of practice in seeing the bones fused together. All right, so here's an example of a question that you might come across in our exam. Since I won't be able to use pictures, I'm going to have to be very descriptive. So this question says, which of these is not considered a cranial bone? And your options are the frontal bone, the occipital bone, the mandible, and the sphenoid. I'll give you a few seconds to think about it. All right, I hope everybody selected the mandible. That one is not considered part of the cranial bone. The mandible is your lower jaw bone. Alrighty, So let's take a look at these cranium bones individually. And the way I've set it up, if you go back to your study guide, is you're going to notice that for each of the bones, I have given a description based on where the location of that particular bone is. And some bones will also have notable structures that we have to highlight. Now, starting off with the frontal bone, that's very easy. For the frontal bone, you just want to be able to know that that's what makes up your forehead. For your occipital bone, that's going to be located more towards the back of the head. And in addition to knowing that it's on the back of the head, we also have some notable structures that we're going to have to be familiar with. One of them is going to be the foramen magnum, which is described as a large hole or opening through which the brain will exit the spinal cord. Anytime you have terminology that includes foramen, I want you to look for a location that includes a hole or a large opening. The occipital condyles will be the location on the occipital bone that connect with the atlas, which is the first vertebra from our vertebrate column. Now, to give us more of a visual idea, let's go ahead and click over to some images. And we can see right here we have our frontal bone highlighted. And if you look towards the back, you have your occipital bone highlighted there as well, in the golden color for the frontal and the brown color for the occipital bone. So you can see location-wise, it's the front of the skull and the back of the skull. If we switch our orientation, we can also see that with the occipital bone, that we went ahead and labeled in blue text the foramen magnum, which is the large opening through which the spinal cord will emerge. And you can also see your occipital condyles, two of them on either end of the foramen, and they will be resting on the atlas or your C1 vertebra. The next bone of the cranium will be your parietal bone. The parietal bone is paired. You have two of them, and they will start on top of the cranium and move laterally. So they make up the side part of the head. Notice how on your list there are no notable structures for the parietal bone, which means that you're only responsible for the location of that particular bone. On this slide, we also see the sutures, but if it's okay with you, I'm going to ignore them for now. We're going to come back to them at a later time. Here's an illustration of the parietal bone. As you can see, it makes up the top side of the skull. Now, also on the side, you're going to have the temporal bone, and the temporal bone will be located underneath the parietal bone. It is also a paired bone. You have one on the left and one on the right, and the temporal bone has quite a few notable structures that we have to discuss, and these are going to be, amongst others, the zygomatic process, the mandibular fossa, the external acoustic meatus, the jugular foramen, the carotid canal, and finally the mastoid process and the styloid process. The zygomatic process can be described as a bridge-like extension that will allow the temporal bone to connect with the zygomatic bone, which is also known as your cheekbone. The mandibular fossa, a fossa is a depression. It will be a dip found underneath the temporal bone where the mandible or the bottom jaw will be able to connect to make up the TMJ joint, the temporomandibular joint. This is often seen when you have, for instance, lockjaw, or if you like to grind your teeth when you're sleeping and you wake up and your jaw hurts, or if you ever get into a fight and someone gets a punch in the jaw can be dislocated. That is because the mandible will slip out of the fossa, the dip on the temporal bone that kind of holds it in place. Now, you will also have the external acoustic meatus, also known as the external auditory meatus. This is basically the opening for your external ear canal. You will also find smaller openings that can be used for nerves and blood vessels, and that is where your jugular foramen and your carotid canal will come in. The jugular foramen is where we have cranial nerves exiting, and the carotid canal is the passageway for your carotid artery, one of the main arteries that runs in the neck region. You will also have the mastoid and the styloid process. Both of these are going to be attachment points for muscles. Now let's take a look at what this looks like. So you can see right here you have your temporal bone, and looking on the side you have a bridge formation that's extending from the temporal bone. That's going to be your zygomatic process, and as you can see it will extend and connect with the zygomatic bone, which is your cheekbone colored in blue. You will also see your external acoustic meatus, which corresponds with our ear canal opening. We have our mastoid process underneath it, and then we have our styloid process in the spike format as well. Now please keep in mind that the mastoid process and the styloid process are both used for muscle attachment. In order to see some of the other notable structures, we have to take a look at an inferior view, and that is where we can find, starting on the right-hand side, the label for our carotid canal, as well as for the jugular foramen. The carotid canal is for our nerves. I'm sorry, my apologies. The carotid canal is going to be for the carotid artery, our blood vessels, and the jugular foramen will also have some blood vessels, but it can also be utilized for cranium nerves. On the left-hand side of the screen, you're going to notice that right underneath the zygomatic process, that bridge extension, you'll have the mandibular fossa, that little dip where the mandible, the lower jaw, will be inserted. And also you can see, not as clearly, you can see the location of the mastoid process and the styloid process. All right, now this view shows you your temporal bone are disarticulated, so by itself. And as you can see, once it separates from the skull, you get a really nice view of that zygomatic process. You can also easily find the styloid process, and then the mastoid process in the back, and our little mandibular fossa clearly